Well, for more, let's cross to our correspondent in Juba, Sudan, Patrick Oyet. Patrick, good afternoon. Thank you for your time here on the SABC at this hour. Perhaps you can give us an update as to what the situation is like in Khartoum as we speak.
Yeah, the situation is still very difficult. Fighting is ongoing. Just 2 minutes before we came on air, there were 2 explosions around the airport area. There's a huge smoke coming out of that area. It's not clear what exactly has been bombed or what exactly exploded. We've also had reports of more troops from other parts of the country coming into the capital, Khartoum, and that also the Sudan Armed Forces are trying to use the aerial power to try to bomb some areas. So fighting is still ongoing, especially in Khartoum.
Patrick, we know that countries from around the world are trying to evacuate their citizens from there. Perhaps you can talk to us, about how difficult it is to get out of there, perhaps as the ceasefire will hold long enough for that to unfold.
It's really very difficult to evacuate. What has been happening in most cases is that many countries were not revealing what they were doing. They would only talk after evacuating their nationals. For example, the US, we discovered when they had already actually evacuated their nationals. The UK did the same. They made the announcement after their nationals were evacuated. We understand there's still a German plane down, of course, trying to carry out another evacuation. Most of that is being done through Djibouti, because there are military bases in Djibouti. For example, the French have a base there, the US have a base there. So that's majorly what they've been using. They would fly from Djibouti into Ethiopia and then from Ethiopia into Khartoum. Now, that is one route that has been used majorly by the military planes. But there are other routes. For example, in the east, Port Sudan has the sea, the Red Sea, and also it has an airport, an international airport. So that route could also be used, but you have to come from Egypt. From Egypt is very near. You can land in Port Sudan. You can also come from Djibouti. You come over the Red Sea, and then you can also land in Port Sudan. Also from Juba, where I am in South Sudan. Myself, I've ever taken that route from here to Port Sudan direct. That route is also available. But the challenge is, from Port Sudan to Khartoum is more than 700 kilometers. And now if you have a team in Khartoum, then you have to drive them to Port Sudan, and that will take not less than 8 hours drive. So that's where the challenge is when it comes to that route of Port Sudan. That's why many are trying to get the people direct from Khartoum. But for South Africa, it might be a little bit easier if the 77 people or how many people are already put together. Then it's easier. Even if you want to move them on land to Port Sudan, that will be easy. But the problem is when the nationals are scattered across the city or across the country, then that becomes a challenge, because you have to first get them in one place, transport them to Port Sudan, and then get them out. Or get them in one place in Khartoum and then land in Khartoum and take them out.
Patrick, just very quickly, you speak about the challenges, including distances and routes, etc., during the evacuation process. What are the humanitarian needs as well at this point? I mean, I can imagine supplies are also running out. Walk us through what you're experiencing on that front.
Yes, supplies are running out. Many residents we spoke to are saying they do not now have food in their houses. Markets that are near them have been bombed, so they do not even have access to money which they have in the banks. Some banks have also been bombed. So the mobile apps that the people used to use to, for example, get money from the banks are not working. The water also is a problem, because water infrastructure has been bombed. So some places totally have no water. Electricity is a challenge. At the time when the temperature in Khartoum is beyond 40 degrees Celsius, many people depend on air conditioners in their houses. It is very difficult, especially for children. Another problem is the issue of hospitals. Hospitals are also running out of drugs. The government, the Ministry of Health, has announced that the only medical store that used to supply government hospital has been destroyed, so there is no supply is going to medical to hospitals. The private hospitals also have a challenge because the pharmacies are closed. So it's really a big challenge for people in Khartoum at the moment.
Patrick, thank you for your time. Let's continue to monitor that situation. Our correspondent in Juba, Sudan, Patrick Oyet, giving us an update. We also just heard from the Department of International Relations and Cooperation confirming that about 77 people, including South Africans, have been verified, and an evacuation process is underway to have them return safely.